Good morning, everybody. I guess it's good afternoon for most of us. I hope everybody's doing well. I'm just going to let people come in on their own here for about another couple minutes. We had a bit of a scheduling issue with Dr. Breus, so he's going to be joining us in about 14 minutes or so, or about quarter after. So in the meantime, we're going to talk a little bit about some of our own sleep programs and some sort of common questions that people ask about obstructive sleep apnea and its treatment in the province of Manitoba. So Dr. Breus will be coming on, but he's going to be a little late, unfortunately. Hope everybody's having a good day though so far. Okay, so I am Owen. I'm the marketing manager for Remologie and Medigas and the rest of the Innervare group. And we got together to create this webinar for two reasons, actually. One was for our own staff, because we're doing one of our wellness initiatives right now called Better Sleep, Better Me. So this is a sleep-themed wellness initiative that's lasting for a couple months and focused on improving sleep within our group. And of course, Remologie and Medigas are companies involved in the world of sleep. So this is something that's very near and dear to our heart. So with us right now, for the first 15 minutes or so, is going to be very graciously our own Gloria McKnight, who's the manager of our clinical team. And she can talk a little bit here about some of the more common questions we get about treatment for obstructive sleep apnea, which is one of many sleep issues that people can experience. And then once Dr. Breus gets on, we'll have him begin his talk, which will be awesome. It'll still go for an hour, even though, he will still be speaking for an hour, even though he'll be coming on a little late. So if you can't make it the full, hour and about 15, maybe 20 minutes or so, that's okay. This will be recorded and posted on the same page that you signed up on for you to watch whenever you want, wherever you want, how many times you want. So that is okay if you need to jump off at the end of the hour. So without further ado, I'll get Gloria to talk a little bit about some of the intricacies of obstructive sleep apnea in Manitoba and some of the ways that you can access treatment.
Great. Thanks, Owen. Hopefully you can hear me okay?
Perfect.
Oh, good. We don't have that as an initial problem. So we may certainly have people on this call that do not live in Manitoba. I can't say how things are done in your province, but we will talk about in Manitoba. And our customers in Manitoba have two different pathways that they can take, either the private route or the provincial route. And I'm just going to talk a little bit about both of those. So in Manitoba, for the private route, you can actually self-refer yourself if you're thinking that you may indeed have a problem with your sleep. So you can self-refer through our company called Remologie, and Ian's going to put that link up in the chat. Otherwise, you can also go to your family doctor and get your family doctor to refer you to Medigas for a private sleep study. So the benefits of going private is it's generally much quicker. We don't really have a wait list. You can have your sleep study done probably within a few days. It is then scored and interpreted by our by our sleep physician, and you can be set up and purchase a unit all within a very quick period of time. And of course, we're going to be giving you that ongoing support. So a very quick way is doing the private route. If that's not in the cards for you, or you want to do something a little bit more, you can certainly see about getting referred to the Manitoba Provincial Program. So the Provincial Sleep Lab in Manitoba is at Misericordia Health Center here in Winnipeg. And that's all going to start with your family physician sending a referral off to the sleep center. There's a little bit of a wait list. Way back when, it used to be 2 or 3 years for the wait list. I believe now the wait list is down to about 1 to 6 months, and it's very dependent on severity and how your life is being impacted. Once you are seen at the sleep center, that sleep study may actually be done in lab at Misericordia Hospital, or they may give you a take-home test similar to a private study. After that point in time, you will have a follow-up appointment with one of the doctors at the sleep center. And that's about 3 weeks after you've done the sleep study, again, either in lab or in home. During that follow-up with the sleep doctor, which is usually done by a phone call, they will provide a prescription, and they can either mail it to you or they can fax it to you, because again, this is probably done by phone appointment. That prescription would then come to Medigas, and we will start your trial. So to be on the provincial program, the sleep center does require that certain criteria be met. It is certainly attainable by almost everybody. We will do a trial for about 3 weeks, but it could be longer. Every person is going to be individual. After that point in time, once you've met their criteria, we've made sure that your mask is doing well, your airway is well protected. At that point in time, we would move you to the long-term provincial program, and the machine, which is $500 for those of you on the provincial program, would be purchased, and you will have ongoing support. So you're never left by yourself. There's some great apps out there that you can also be monitoring your own therapy, and Medigas staff is always willing and able to help you with whatever issues you might be having. So regarding ongoing support, for the last many years, Medigas has created the OSA support group. So anybody with obstructive sleep apnea is welcome to join our support group. And we do meet monthly, the last Tuesday of every month from 7 to 8 p.m. And we do that virtually. So whether you're in New Brunswick, in Ontario, in the Paw or Thompson in Manitoba, anybody can join. There's no charge for that. And it's quite often we will have a guest speaker. And again, we're here to support you. So if you are having any issues, any support, you want to talk to other people with that same diagnosis of sleep apnea, we're here for you and here to help facilitate and offer some continuing education to you as well. Oh, and I
Awesome.
think there you go. Perfect.
There we go. Thanks, Gloria. So that was great. We're still waiting on Dr. Breus, which is okay. He should be in the next 5 minutes or so. So I'm going to talk just a little bit quickly about our next OSA support group meeting, which is on next Tuesday. And our speaker is a really interesting guy. His name is Dr. Elliot Lee, and he is a clinical psychologist or psychiatrist, at Royal Ottawa Mental Health Center. And he actually specializes in sleep and sleep disorders. And he's going to be joining us on Tuesday to talk about the link between obstructive sleep apnea and dementia. And there is a link between the two diseases. And there is also evidence to show that the use of a CPAP machine, which is a machine that's used to help treat obstructive sleep apnea, that this machine and the use of it can actually decrease the effects of dementia in people who are experiencing dementia related to sleep apnea. So really interesting talk. He's a really interesting person, and we're really excited for that. So it'll be a great chance to learn a little bit more about sleep and some of the issues that revolve around sleep. And we hold these meetings every Tuesday, at the last Tuesday of each month. So we hold them on a regular basis, and we have a good group of people that attend every meeting, and we talk about all sorts of things. We usually have a speaker, whether it's from our own staff, people who are experienced sleep therapists, or clinicians who talk about various problems around sleep apnea, whether it be some of the more annoying issues that people can experience related to things like condensation, irritation, or just general advice and support on obstructive sleep apnea, which can be quite a debilitating problem, especially if it goes untreated. So apologies again for this. We should be seeing Dr. Breus quite quickly. We do have a Q&A section if people want to ask any questions. We do have some questions that were entered prior to the webinar on our sign up page. So we'll be getting to those probably towards the end of the meeting with Dr. Breus. But prior to that, you can answer some questions in if you would like. I know that we have a question from someone here, and they asked, you mentioned we can order sleep apnea tests online. What type of tests are available? Gloria, do you want to answer that one?
Sure. So the take-home tests we offer at Medigas either a level 3 or a level 2, and there's a slight difference as well as cost between the two tests. So the level 3 is a pretty simple test. It's monitoring your airflow. So you've got little prongs at your nose. It's measuring your chest wall movements. You've got a belt around your chest, and of course a little clip on your finger, which is measuring your oxygen. So a pretty quick and easy test that is pretty simple and easy to hook up. Additionally, we have for the last many months been doing level 2 tests, and level 2 tests are a little bit more comprehensive. So because of that, there's a few more wires to connect. You've additionally got a monitor that is strapped on your head. It's measuring your brain activity. You've got monitors on your legs to measure for anybody that may have, say, restless leg syndrome. There's a few other monitors in there. So a little bit more involved to put on and take off, gives a lot more detail, can pick up on more sleep disorders other than just obstructive sleep apnea. But yeah, we can, we'll send those out pretty much anywhere in Canada, and we will get the results and have that discussion with you after you do that study.
And the company that provides us with the level 2 sleep tests is called Cerebra, and they are great partners of ours, and we're very pleased to be able to offer their tests because they are, as Gloria said, very technologically advanced and have some really cool data that they can capture about sleep. I have taken one personally, and it showed me a lot of interesting things about waking up at night, and how quickly you fall asleep, and all sorts of information revolving around things like that. So really interesting test. And we also provide sleep apnea supplies. So we have an e-commerce store. You can either visit us at medi-gas.com or at remologie.ca to purchase sleep apnea supplies. And we also have a subscription. So we have a subscription for sleep apnea supplies that will send you everything you need on a regular schedule, whether that's 4 times a year if you've chosen a premium subscription, or once a year if you have a starter subscription. And it comes with everything that you need to either get started on sleep apnea treatment or to have sort of like the full experience with the optimal amount of supplies. And it's really convenient. You also get a permanent 10% discount online. So it's some interesting stuff. So we should be seeing Dr. Breus just in a couple minutes or so, if not right away. And we will then get into the meat of our presentation, which I think you guys will really enjoy. So yeah.
Oh, and I just also wanted
sure.
to mention that if there is anyone in Manitoba that has had their name given to the province, to the sleep center for a study and haven't heard anything yet, certainly feel free to use me, and Owen, you can type in my email in the chat as a resource. I meet with the sleep center about every 2 weeks, and I can assist you with that if anybody's having any issues.
Perfect. Thank you,
And
Gloria.
welcome, Dr. Breus.
Howdy, howdy. I apologize for my tardiness today, but I am here and ready to roll.
All good. That's awesome. So I'm just going to allow you to share. So you can share. We've had a good discussion about Remologie, and so
awesome.
We're ready to go whenever you are, and we're all looking forward to it.
I am ready to be here, so thank you all. Let me give you a brief outline about a little bit about me. Owen may have told you a little bit, but just to kind of give you my stats, if you will. So I have a PhD in clinical psychology from the University of Georgia, and I'm double board certified in both clinical psychology and clinical sleep disorders. I'm a fellow of the American Academy of Sleep Medicine, and I've been very fortunate, published a bunch of books. I think you guys out there may be getting some sometime soon. And I've been in private practice for 23 years. Owen is a good buddy of mine. I've worked with Remologie now for several years, and I'm going to be very straightforward with you. These guys are pushing the envelope in terms of compliance, understanding, and really getting people better with sleep apnea. So the reason that I've associated with them is because they're doing all the forward thinking and making sure that clients are sleeping better. But, you know, a lot of people wonder, like, what is sleep? How does it work? And what do we need to know about it, Dr. Breus? So guess what? I'm going to lay it all on you right now. Just to let everybody know, the slides will be made available for you afterwards. If you'd like, you're welcome to have them. So what is sleep and how does it work? It turns out that sleep is based on two separate systems in the brain. One is called your sleep drive, the other, your sleep rhythm. So sleep drive works a lot like hunger, right? So I'm hungry, I'm hungry, I'm hungry. Then I eat something and that hunger begins to dissipate. The same holds true with sleep. Most people don't know it, but when a cell eats a piece of glucose, something comes out the back end. One of those things is called adenosine. Adenosine works its way through your system, gets to a very specific receptor site in your brain, and as adenosine accumulates, you get sleepier and sleepier and sleepier. That's kind of the mechanism behind the sleep drive, if you will. The second system is called your rhythm or your circadian rhythm. Also a little bit like hunger. You ever notice you're hungry around breakfast time, around lunchtime, and around dinner time? Same holds true with sleep. Most people, at least here in North America, are tired somewhere between 10 and about 11, 11:30 at night. So when your drive is high and your rhythm is in sync, you sleep. But if either one of these is off, that's when you can have a sleep disorder, or what I also call disordered sleep. So I'm going to take you back to high school for just a second, and I'm going to remind you about all of those sleep stages and what they do. So this over to the left-hand side of the screen, you'll see is a hypnogram. So a hypnogram actually represents sleep across an entire evening. The orange turns out to be wake. Then you go down into light sleep, which is represented by those small gray bars. Then into deep sleep, which is represented by the dark blue, back to the gray, and then on into the light blue, which is REM sleep. That little dance maneuver there takes approximately 90 minutes, and most people have 5 sleep cycles. So the average sleep cycle is 90 minutes, and most people have 5 of those. But what do these sleep stages do, and why do we actually care? So it turns out that stages 3 and 4, what we call deep sleep, this is the wake up and feel great sleep, right? This is your physical restoration. Your blood pressure drops, your respiration slows. This is really where true cellular repair occurs. So, by the way, this is the most important part for your immune function, which is pretty important for most of us right now. So getting your stage 3, 4 sleep is critical, critical, critical to your overall health. REM sleep is the other area that's important. That makes up roughly 25% of the night, and this is your mental restoration. So this is where we move information from our short-term memory to our long-term memory. So a lot of people don't think about memory all that much, but sleep has a tremendous effect on that. So what's interesting about this is the process of moving information from your short-term memory to your long-term memory kind of creates an organizational substructure inside your head, kind of like a filing cabinet. So this piece of data that comes in through your eyes or your nose or your ear, it's got to have some place to go, right? And so it goes into it has to find the right filing cabinet, has to find the right drawer, and then has to find the right file to put the information into. That entire process, we think that's called dreaming, okay? So that in and of itself, that moving of the information, that's one of the most important things that goes on during REM sleep. And we know that dreaming occurs because of that. By the way, interesting thing is that you're completely paralyzed during REM sleep. This is so that you do not act out your dreams. Now, the reason I bring this up in particular is there is something called REM-dependent sleep apnea. So this is the reason why we have a tendency to have more problems with our sleep apnea during REM sleep, because all of our muscles are paralyzed except for our intercostal muscles. Our diaphragm still allows us to breathe. So we will have to sometimes wait until the very end of the night in order to be able to see how much apnea a person has, because look how far REM sleep is towards the back end of the night. So this is one of the reasons why it's important to always understand and get your REM sleep. So I don't know, why do we need sleep? This has been a big topic of discussion for a while, and quite frankly, we don't have any great answers for it, but we know what happens when you don't have good sleep, right? So in our brain, we have all of the memory lapse, impaired judgment. My daughter says it best: you become a grumpy fish if you are sleep deprived. I think that says it all, pretty much, right? Grumpy fish, I think that's the most descriptive thing I've heard in a long time. Also, our gut becomes impaired. Remember, most of your killer T cells, white blood cells, are produced in the gut. And we know that with poor sleep and sleep deprivation, it has a dramatic effect on the microbiome. Remember, you can have sleep deprivation from a whole host of things. Sleep apnea is certainly one of those things. Could be insomnia, could be a combo platter of both. The heart also has a lot of problems with it. So one of the things we know is that you actually have decreased heart rate variability when you're sleep deprived, and you can actually have a significant increased risk of stroke, which is no bueno, right? And then of course our muscles, we see a lot of things like aches and pains and all of those types of things that are occurring for people when they're sleep deprived. Now, okay, Michael, so we know what sleep is, we know kind of how it works, and we know what sleep deprivation is. How much sleep do we actually need? Well, it depends upon your age. So what's interesting about that is sleep turns out to be very developmental. This graph actually should help you quite a bit, but you can see with adults, we're looking at somewhere between 7 and 9 hours of sleep a night. Remember something, guys, 8 hours is a myth. Not everybody gets 8, so don't try to give yourself a hard time just because you didn't get 8 hours, okay? I'm the sleep doctor, and I get probably 6 hours and 30 to 6 hours and 45 minutes, so don't feel too terrible. What causes sleep disruption? This is a very big, long list, but I think we can really break it down into 2 specific categories. One is the one we're talking about quite a bit today, which are sleep disorders. Obviously, sleep disorders include formally diagnosable situations. We've got apnea, narcolepsy, restless leg syndrome, periodic limb movements, insomnia, even sleepwalking. These are all areas that Remologie can help with identification and treatment for, right? Disordered sleep, this is a whole other category. And this is where compliance comes in. This is where we look at things like fatigue, restlessness, pain, and again, people not sleeping based on their chronotype. I wanted to double tap real quickly on sleep apnea, just in case people here don't know exactly what it is. There are some interesting definitions out there because there are different types of apnea. Obstructive sleep apnea is where your throat just whoosh, sucks together and closes. Now, there's usually an obstruction, right? So you got big tonsils, you got big adenoids, maybe you carry a lot of weight around your neck. Any of those can cause that throat to slowly narrow and eventually with that suction, close off, and that is an obstructive apnea. There's another kind of apnea too. It's called central apnea. This is where your brain tells your lungs, don't breathe. That is a much more serious situation. Different kinds of treatment that are available for that, but it is something that is treatable. Now, there's also the combo platter, of course, right? Which is if you've got some obstructive and some central, then you've ended up with mixed apnea. There are several different treatments for sleep apnea that are out there. And I wanted to be clear about that. There's something called CPAP machine, right, which is where it helps you breathe. There's a BiPAP machine, which is one pressure breathing in, a separate pressure breathing out. Something called an ASV machine. This is a little bit more complicated, something that helps us with mixed and both central sleep apnea in terms of treatment. If CPAP isn't your thing, there are oral appliances that are available. And of course, weight loss, if you happen to be a little bit on the bigger side, has been shown to have significant advantage in terms of your overall compliance and treatment for sleep apnea. Next is another biggie, insomnia. And this is what I hear from my clients all the time. I can't turn off my brain. I fall asleep and wake up and can't go back to sleep. I don't need sleep, Dr. Breus. Sleep is for, I'll sleep when I'm dead. I've heard that a lot of times. You know what I tell people? You're going to die a lot quicker, my friend, if you don't follow some of my suggestions. What should you try if you've got insomnia? I'm not the biggest pill guy. So I really like to work with people outside of pharmacy before we get there. But I want to be clear about one thing. There are plenty of people on this earth that need a pill to sleep. That's okay. It's not their fault. Maybe they've got pain. Maybe they have a mental health issue. Maybe they have a medical issue. There's lots and lots and lots of reasons why people use pills to sleep. So this is not about shaming anybody or telling anybody, don't take your pills. This is, however, telling people that there are many behavioral and non-pharmaceutical ways to use in adjunct to your pills and or in replacement of, if you work with your doctor and work on some of these things. I will tell you the one thing that everybody can do very easily, a sleep diary. It's super simple. You just answer a few questions. And this way, when you arrive at your sleep doctor's office, you can actually present to them some data that can be extremely helpful. There's about 5 or so questions that you would want to put into a sleep diary. What time did you get in bed? What time do you think you fell asleep? How many times did you wake up throughout the evening? What time did you wake up for the day? And how do you feel in the morning? If you just answered those 5 questions for 7 days and gave that to your doctor, that would give them a tremendous amount of information to be able to start working with you. These are a few of the other ideas that I have when I work with clients specifically for insomnia, but I really try to work with them in improving sleep hygiene and using things like progressive muscle relaxation and electronic curfews. But a lot of people want to know, when should I see a doctor about my sleep? Well, number one, if you look over here on the left-hand side, these are sleep-related symptoms. So these are all ones that relate to apnea, narcolepsy, periodic limb movement. So these are the ones that you really want to think of when you're thinking sleep. However, there are a lot of medical conditions that can absolutely affect your sleep. And so for folks out there who are struggling with or having treatment for heart failure, heart disease, obesity, diabetes, you really want to be thinking about talking about with your doctor about sleep and whether or not you could have an undiagnosed sleep disorder. As an example, when I have patients who are obese, snoring, and diabetic, I absolutely send them to the sleep lab, because even if they're not symptomatic, oftentimes we find mild sleep apnea, which is this undercurrent, which really messes up things like insulin resistance and makes diabetes much, much worse. So for folks out there who are thinking about seeing a sleep specialist, number one, they don't bite. Number two, go make an appointment, okay? These are people who are designed just to look at your sleep. Most general practitioners haven't really had a tremendous education in sleep, so sometimes it's worthwhile to go to a specialist. Now, when we're talking about sleep hygiene, believe it or not, only 1 in 10 Americans consider sleep to be a top priority of their day. So these are some of the recommendations that I give people. You'll notice that they are not the normal everyday sleep hygiene recommendations. So one of them is go to sleep and wake up at the same time every single day. I don't care if you don't go to sleep at the same time every day, but please wake up at the same time every day, including the weekends. Now, I want to be clear about this. There's a great study that was done looking at, can you catch up on your sleep on the weekends? I'm here to tell you, and people are not going to like this, no, you cannot catch up on sleep on the weekends. Great study. They took 50 people and they said 5 hours of sleep during the week, 8 hours of sleep on the weekend. We're going to test you every Monday on 4 different things: memory, attention, focus, and mood. Every single week, we saw decrements in memory, attention, focus, and mood. But here was the most important thing. When we asked them on Monday, how did they feel? They said they felt that they were at 100% and that they had gotten an A+ on all of the measures. Even in the 5th week, when we saw decrements of 40 to 50% in accuracy, their brain told them by getting that 8 hours that they were fine, and they're not. So that's the big thing that people really have to understand, is that level of consistency in sleep is really the key that starts the engine for just about everything. Exercising regularly is a big thing for me. Owen knows that I'm a big fan of that, but you don't want to exercise too close to bedtime because it brings up your core body temperature. And remember, we want to be cool to sleep. Limiting naps is probably a good idea. I tell people all the time, if you're going to take a nap, don't want to take it much past 2 o'clock because that can really affect your ability to fall asleep. Obviously, avoiding alcohol, tobacco, caffeine, and things like that is going to be helpful for sleep. And my favorite one is the one on the bottom to the left, which is spend more time outside late in the day. Like, life is not easy right now. So relax, walk your dog, breathe some fresh air, like just go out. I get it. You might be in a place that's cold. All right. It's okay to just sit out on a covered porch and just relax for a little bit. It's going to be so beneficial for you. And the stress level that we're seeing is unbelievable. Interesting statistic. During COVID, we'd seen a 23% increase in sleeping pill prescription writing. 23%. I mean, we've never seen anything like that before. So people really need to hold on, stop, relax. You can definitely affect your sleep. My power down hour is one of my favorite techniques. So I thought I would go into that again and teach people kind of to give yourself runway to land the plane. So let's say you're going to bed at 11, starting at 10 o'clock, take 20 minutes to just do things you got to do, 20 minutes for some type of hygiene, and then 20 minutes for some type of meditation, relaxation, prayer, something that's positive, that's a distraction that allows you to slowly get there. Okay. Sleep's not an on-off switch, right? It's more like slowly pulling your foot off the gas and slowly putting your foot on the brake. You got to give yourself some space to get there. You can do it. Like, every single person has control of their sleep. Just set yourself up for success, not failure, right? So other things that you can do, positive distraction. One of my favorites, a gratitude list. Now you might be saying to yourself, well, oh, hit it too fast. You might be saying to yourself, well, Michael, come on, gratitude. Like, is there any science behind that? Yes, there is. So it turns out optimism before bed not only helps you fall asleep more quickly, but gives you more positive dreams. To be honest with you, I could use some more positive dreams right about now, and falling asleep quicker is always a bonus. So I do a gratitude list most nights. Now, the gratitude list doesn't have to be some extensive thing. You can just sit there in your head and say to yourself, what am I grateful for today? Maybe it's the roof over my head. Maybe it's the food in my belly. Maybe it's just the people that I care about. Sometimes it's going to be a lot, sometimes it's not, but getting away from yourself, being grateful for what you have, helps slow down your heart rate, helps slow down your anxiety, helps slow down your blood pressure. Remember, you're trying to get to a heart rate of 60 or below. That's the goal here. That's the metric that you're trying to achieve. What if I don't have insomnia, but I wake up at night and I can't get back to sleep? This is the number 2 question that I get asked. Number 1, by the way, is what bed should I buy? It's kind of funny being a sleep doctor that they ask me about mattresses all the time. So I've had to learn about that as well. If I don't have insomnia, but I wake up in the middle of the night, what do I do? Number 1, look at your biology, right? So don't go to the bathroom unless you actually need to. What do I mean by that? Most people don't realize it, but you want to get a heart rate of 60 or below to get back to sleep. If you go from a lying position to a seated position to a standing position and you walk across the room, I got news for you. You're probably increasing your heart rate. So if you don't have to pee, don't pee. To be clear, if you got to go, please go to the bathroom. Number 2, if you can, stop fluids about an hour and a half before bed. Check with your doctor in case you're diabetic. Number 3, how do you get your heart rate back down if you did need to use the restroom? My favorite technique is 4-7-8 breathing. So this was developed by Dr. Andrew Weil at the University of Arizona. And he has a massive center there. And it's really quite interesting. He works with the Navy SEALs. And this was to help them lower their heart rate during sniper training. So this is where you breathe in for a count of 4, you hold for a count of 7, and you breathe out for a count of 8. Once again, in for a count of 4, hold for a count of 7, out for a count of 8. What we've discovered is this helps lower your heart rate by dumping all the excess carbon dioxide out of your lungs and allows you to breathe much easier, and you can bring your heart rate down very, very quickly. Usually in about 4 or 5 cycles of this, you're very, very relaxed, and that allows that natural sleep process to again take over. The other thing is be positive in the middle of the night. Most people turn to me and they say, Michael, I look at the clock and I get so upset. I think, oh crap, it's 3:30 in the morning. I got to get up at 6. Sleep, sleep, sleep. And they try to sleep. Here's the thing. I don't know about you guys, but sleep is a lot like love. The less you look for it, the more it shows up. You ever notice that? How you're looking for that perfect person in your life, you never quite find them. The second you stop looking so hard, they wander right in. That's exactly how sleep has ability to work. So in the middle of the night, you're going to look at the clock, which I really wish you wouldn't, but I know you will. Do me a favor. When you look at the clock, say to yourself, it's okay. I'm not going to have a terrible night. There's also some data now coming out about something called non-sleep deep rest. So this is interesting. So lying on your back in a quiet room with the lights off is actually rejuvenative. Now, I want to be clear, it's not the same as sleep, but if you did that for an hour, it's worth about 15 or 20 minutes of sleep. So if you wake up at 3:30 in the morning and all you did was just lie there and relaxed for 3 hours, it would be as though you had gotten an hour's worth of sleep. So again, chill out, be positive. What that does then is it allows that anxiety to go down, that heart rate to go down, and the natural sleep process to take over. Externally, you want to think about your environment, right? Maybe you install night lights between the bedroom and the bathroom so you don't have to turn on a light. Put your phone away. I can't stress this enough. And if one person out there says, but Dr. Breus, I use my phone as my alarm in the morning, go to Target and buy an analog alarm clock for $10. I'll buy it for you if that's what needs to happen here, but you don't have to have a phone next to your head all night long. And if at all possible, please don't watch the clock. I know you will, and I want you to be positive when you do, but if you can avoid it, you're going to be in much better shape. Also, when all else fails, get up and do something that's relaxing and non-stimulating, right? So if you try the 4-7-8, if you're relaxing and it's not really going anywhere and you feel yourself getting frustrated, that's okay. Get up, move to another room, lower your anxiety, lower your blood pressure. You can come back to bed or sleep on the couch or in the guest room. There's no harm in that at all. So the last thing I wanted to do was I wanted to give you guys some ideas of what can you do in the morning time to wake up and feel the refreshment of that great sleep that you just got. Number one, I hope you can wake up without an alarm. That would be awesome because that means that you're waking up naturally with your chronotype, which is really, really good. Number two, don't hit the snooze. So here's the thing about snoozing. Snoozing is probably the worst invention in all of sleep. One of the things that we discovered is a snooze is approximately 7 to 9 minutes long. You can't physically get back down into a deep stage of sleep during that period of time. So when you hit the snooze, all you're doing is giving yourself light, crappy sleep. Number two, upon awakening, one of the first things I do is what's called a figure 4 stretch. So this is actually what it looks like. I do it lying down in my bed. This helps release my back because I have low back pain. It helps open up my back. And this is the first thing I do in the morning. Then I take 15 deep breaths. Then I have my glasses of water and I'm off to run. So here we go. Hydrate, hydrate, hydrate. Most people don't know it, but sleep in and of itself is a dehydrative event. You lose almost a full liter of water every night that you sleep, just from the humidity in your breath, believe it or not. So when you wake up in the morning, please don't caffeinate, hydrate. I promise you, it will work better in the long run for you. If you can, try to get another 36 ounces of water in there for you. Again, you heard me say it before, but I try to get sunshine every single morning. It turns out that when sunlight hits your eye, it can actually turn off the melatonin faucet in your head. So it helps with brain fog. And quite honestly, it's nice to be out in the morning. I get out there with my dogs. We go for a 10-15-minute walk. I get my sunshine. I get some time with my dogs. I get a little bit of exercise and some fresh air. It's the perfect way to wake up. And that's what I talk about breathing. It's a good idea to consider doing breath work in the mornings. What I do, I work with a group of guys and every morning we do something called Wim Hof breathing, but you don't have to do anything formal. You could just do 20 big deep breaths. That would absolutely work for you. It helps reset your whole neurologic system and it helps get you ready for the day. One other thing that you could do if you want to make it a really souped up morning is a cold shower. Now, you might be saying to yourself, are you kidding me, Dr. Breus? I don't want to take a cold shower. That sounds miserable. There's actually data to now show, number one, it's actually pretty healthy. It can help you lose weight. And believe it or not, it can help you sleep at night. If you can, stay physically active. Owen knows I'm always on the go, running here and running there. Do yourself a favor. If you can, be active once a day. You don't have to run a marathon. We're talking 20 minutes of cardio here. And it doesn't have to be at a full sweat either. It's just about moving your body to avoid that stagnation, that inflammation, and that stiffness and that soreness. Here's the rules on caffeine, folks. You don't want to have it first thing in the morning. Remember, you want to hydrate. But if you wait 90 minutes after you wake up, your cortisol has dropped, your adrenaline has dropped. Now is the time that it can be helpful. But I also want to bookend that and tell you, you really don't want to have much caffeine after 2 p.m. Now, you notice I didn't say get rid of caffeine altogether. I just want you to stop by 2. Most people don't know it, but caffeine has a half-life of 6 to 8 hours. So if you stop at 2, 8 hours later is 10, when most people are kind of trying to fall to bed. So that might work out well for you. If you can stop at 12, that would be better. If you can stop by 10 a.m., that would be even better. So with that, I'm going to open it up for questions. I have a new book out all about these things called chronotypes. And how to use them in different ways for your health, for your body, and for your sleep. So with that, Owen, let's open it up for questions from the gallery.
Okay, awesome. So first of all, thank you, Dr. Breus. That was an amazingly informative presentation. I really appreciate it.
Everybody was drinking from the fire hose on that one, right?
Exactly. A lot of information in a short amount of time. So the questions are open for anybody. We have a couple here. We also had a couple that came in as part of the question form on the sign up page. So I think what we're going to do is we're going to start with those questions just so we can, get those ones that were asked before out of the way. And then I'll move on to the Q&A questions that are being asked at the moment. So the first question from someone was, I don't sleep well at night, sometimes not at all, yet I have no trouble sleeping during the day. What's going on?
Got it. So number one, maybe you look for a night shift job. No, just kidding. So here's the thing is some people, they get their circadian rhythm can get thrown off. It can happen for a whole host of reasons. Some of them medical, some of it travel, some of them just behavioral. So one of the things that I do when I work with people who tell me I'm exhausted at the daytime and I'm wide awake at night, the first thing I do is I want to know what their chronotype is. You might be a wolf chronotype, which is that late night, night owl type of chronotype. And there might be some things that we can do to help give you some ideas of when to sleep that might work a little bit better for you. If you are a shift worker, then in fact, we can use things like melatonin and light therapy to be able to push your circadian rhythm one way or another. But shift work is honestly not my particular area of specialty. There's a wonderful website called circadian.com. We can put it into the notes for folks where they have lots of free information for folks who are shift workers, if there are folks out there that are doing that. If it is the fact that you are just not able to fall asleep at all in the evenings, it might be worthwhile to come and see one of the sleep specialists to understand a little bit more about what could be going on. Sometimes that turns out to be a case of undiagnosed sleep apnea. Sometimes it turns out to be a case of insomnia, but having a doc look at it is probably a good idea.
Awesome. So the next question is, would having glaucoma keep me from sleeping? I fall asleep for 2 hours and I have to use the bathroom and then I can't go back to sleep. I'm 81.
Okay, so this is an interesting question and it's a little on the complicated side. So number one, I am not a neurologist, nor am I an ophthalmologist. Glaucoma, however, does have some interesting associations to it in terms of light exposure. So folks who have glaucoma don't get as much light in, and so they don't have as easily circadian changes. So remember, when we walk outside in the sunshine, our brain shuts off our melatonin. Well, with folks with glaucoma, that doesn't always work in the same way, shape, and form that it might for somebody who's got healthy, non-glaucomic eyes. So one of the things we do know is there can be some of that going on. One of the things that I do with my patients, especially my patients who are in the older age range, in that 80 plus age range, is we actually use light therapy in the morning times, and then we actually help them a little bit at night by taking them away from the light. So I think there's a way that we could probably help her out, either using light therapy and melatonin or just using light therapy. But yes, to be clear, glaucoma can have some issues with it. Now, people might be wondering, wait a second, she said she has glaucoma. Why would light therapy help? Remember, light doesn't only come in through your eyes. You actually have sensors that you can sense light all over your body.
Awesome. So the final question that was asked before the webinar was, how can I get uninterrupted sleep?
Man, if I had that, if I could answer that question, I think I might be the richest guy in the world at this point. Well, I think that I'm joking, but I think I can give you some ideas. So number one, if you sleep based on your chronotype, that's when your natural body wants to sleep. I think that is a way that you can have less interruption. Number two, think about all the external factors that can be disruptive, and let's try to remove those. Caffeine, alcohol, light, temperature, things of that nature, right? So trying to have an undisrupted sleep means we have to actually think about sleep during the daytime before we get to sleep at night. You know, most people kind of use sleep as sort of the shock absorber of their life, right? So it's like, I'm really stressed out. I got a lot of stuff I've got to do. I'm not going to bed, on time tonight. I got to work. They, push themselves to a limit, get less sleep, are more anxious. It doesn't work out particularly well. So for most folks, what we're really trying to do is get them to have good, consistent sleep. And if they can, do it based on your chronotype. That's how we get less disruption in there. Of course, if you've got a snoring bed partner, that can actually be pretty disruptive, and you may want to actually send them in for a sleep study, right? So, there are other disruptions that are out there, especially snoring can be one that's very, very difficult. Other things that could happen environmentally, dogs, cats, those types of things can be super disruptive for your sleep. And then finally, medical conditions. If you have conditions such as pain, that can certainly be disruptive to sleep, congestive heart failure, high blood pressure, all of these things can have disruptions to your sleep. And by the way, some medications can actually be disruptive to your sleep. So definitely talk with your doctor about going through your medication list and making sure that none of those could be disrupting your sleep as well.
Perfect. So we actually had a question come in through the Q&A that's, I think, actually fairly topical to what you just talked about. So this person asks, how disruptive is my 5-year-old coming to Snuggle in the early hours of the day? And primarily, what type of disruption is this?
So it's a great question. So number one, there's no question it is disruptive. And by the way, if they're coming in every single day, it's not because they're having a hard time sleeping. There's something else that's going on. They're lonely, they're scared, they're fearful, they're depressed. Well, I don't know what it is. 5-year-olds really don't belong in your bed. That's number one. Number two, is it disruptive to your sleep? It depends upon when they come in. If they come in the early morning hours, if you remember from our hypnogram, that's when you have the most REM sleep. So if you think about it, the child wandering in at, let's say, 4 a.m., hopping in bed, disrupting your sleep, you then have to get back into light sleep, then get back into deep sleep, then get back into REM sleep. That's going to take some time. You're going to have less REM sleep, which means you're going to be less mentally focused. Remember, REM sleep is that mental restoration. So if your child is walking in at 4 a.m., it's probably disrupting your REM, which is probably going to throw off your memory and a whole host of other things. So remember, your kid can sleep in their own bed. I get it. It's not fun. They show up at 4, mommy, I want a glass of water. I want this. I want that. Can I just crawl in? And it's super easy to say, come on in, baby, just hop in and we'll fall asleep and we'll deal with this in the morning. But what you're teaching your child is that they don't have to learn how to sleep by themselves, and they will continue this behavior, which will be, unfortunately, super disruptive.
Okay, awesome. So we have a question about chronotypes here. So we have someone who says, do you have some good advice for the dolphins out there? And yes, the book is already on order. Also, did I go wrong somewhere and that's why I'm a dolphin?
So number one, I wrote the book just for dolphins. So I'm super excited that you're getting the book. The sleep schedule in there is the one that really works exceedingly well for dolphins. It's got a little bit of leeway and there's a couple factors in there. So as you get into the book, it'll teach you exactly what you need to do. If you know that you're a dolphin, that means you've also probably gotten my information from an email, which should be helpful for you as well. I would do all the things that you're seeing in the emails before you get the book because they're very consistent with the book. So you'll already have some of that information. But here's the good news. Dolphins can figure out how to sleep. It's not a lost cause. You didn't do something wrong. It turns out it might be some of your genetics are just kind of messing it up a little bit. Therefore, we have to make sure your environment is really good. We have to make sure your planning is really good because your genetics are working a little bit against you. Good news, it's not about a big failure. You can definitely control your sleep. And that's one of the things that dolphins are looking to do. So I wrote the book specifically for dolphins. So I think you're going to be okay.
Awesome. And just what is the title of that book again?
The title of the book is called The Power of When, was my third book. And my newest book, which uses chronotypes in a further advanced way, is called Energize, Go From Dragging Ass to Kicking It in 30 Days.
Perfect. Okay. So next question. I've incorporated many of the behaviors Dr. Breus mentioned to improve my sleep hygiene, but I'm still waking up feeling unrested and tired throughout my day. What are my next steps / what should I do?
So in that particular case, here's what I would think about: a sleep study. If you've really done all the different things that you needed to do and you're still waking up feeling fatigued and tired, then quality of your sleep is something that I would be thinking about a whole lot. So if let's say you're getting 6.5, 7 hours of sleep, I don't know, 6, 7 nights a week, and you tell me that you're still exhausted, I want to bring you in for a sleep study, because you could have upper airway resistance syndrome. You could have a mild case of apnea. Maybe you got periodic limb movements that's disruptive to the quality of your sleep and you don't even know it. So that if you're following all of these other recommendations and you're still pretty tired, I would definitely talk with a sleep specialist.
Awesome. Okay. So next question. The older I get, the harder it is to fall and stay asleep. Is this common, or do you think I could have a sleep disorder?
So it's common, but you could have a sleep disorder. So that's the problem, is as we age, there's lots of different things that can affect our ability to sleep. Medications, medical conditions, just an aging body frame can do that as well. So all of those could be contributing, or it could be an undiagnosed sleep disorder. That's one of the reasons why I always tell people, look, it's worth it. It's usually covered by insurance almost all the time. And it's really good to, if nothing else, have a baseline so we know kind of what we're dealing with.
Perfect. So someone asked, you mentioned restless legs is related to sleep apnea. How do you treat this?
So restless leg syndrome is a creepy, crawly feeling that you have on your legs before you're falling asleep. And the only way to get rid of it is to stand up and walk around. If you stand up and you still feel that creepy, crawly feeling, that's called peripheral neuropathy. And that's something you would want to talk about with your doctor. But if it goes away with movement, it's probably restless legs. Interestingly, there's now data to suggest that this could, at least in part, be an iron deficiency. So this in part could be due to a specific type of iron called ferritin. So I tell people, if you've got that restlessness feeling, number one, you could talk with your doctor about having blood work for ferritin, or number two, you could go to local Walgreens and buy some iron sulfate, FeSO4, 325 milligrams. Take it at night, 1 tablet only, and see how you do. To be clear, if you start taking iron at night, iron sulfate at night, it can be quite binding and cause some level of constipation. So be careful. You may want to add magnesium with it or calcium with it. That will help everything kind of move along.
Perfect. Okay, so next question. Can you speak about insomnia, how you diagnose it, and a little bit about treatment as well?
Sure. So when we think of insomnia, I think of it in what I call the rule of threes. So it needs to take you longer than 30 minutes to fall asleep, or you have to wake up more than 3 times a night for longer than 30 minutes for more than 3 weeks, then for that more than 3 months. So it has to be fairly consistent to officially be called insomnia. That being said, there's a lot of times we don't need to call it insomnia, but we can treat it roughly the same way. The very first thing that I do with all of my patients who report to me of poor sleep quality or insomnia is I do blood work to see where's their magnesium, where's their vitamin D, where's their iron, and where's their melatonin. If those are off, I got to fix that first and make sure that the body is working first. Once those are on, or if there are no deficiencies there, then we do a formal assessment where we start to look at things like, how long does it take you to fall asleep? How many times do you wake up in the middle of the night? How long are those awakenings occurring? Are you able to return to sleep? There is something called cognitive behavioral therapy for insomnia. I am trained in this. This is what clinical psychologists have been trained to do for many, many years, and it is highly effective. Believe it or not, there's data to show that cognitive behavioral therapy works better than sleeping pills and lasts longer than sleeping pills do. The only difference is sleeping pills work quick. So on occasion, what we'll do is we'll say, let's use a pill to break the cycle of insomnia. Then we'll taper somebody off of it within 6 to 8 weeks. During that period of time, we're teaching them sleeping rules and we're giving them very specific sleep schedules to follow. And that's the behavioral part of cognitive behavioral therapy. Then we move into the cognition. So what do people think about sleep and how do we change some of those thoughts so that they're not so scary for people and they're able to relax and fall asleep. After that, of course, there's over-the-counter sleep aids that some people will use. I want to be very careful about these. You must understand that there's significant data to now show there is a high correlation to continued use of diphenhydramine, also known as Benadryl, which is the PM part of almost every PM out there, is a distinct link to Alzheimer's and dementia. So I want to be very clear to people. If you are taking these medications every single night to help you fall asleep, talk to your doctor. There's something better that won't give you Alzheimer's, right? So like, they're like behavioral, everybody can sleep. I haven't met anybody yet who's got like a broken sleep switch in their head. So it's really just about, what is your commitment? Are you willing to, be uncomfortable for a little while and figure it out? Your body's going to sleep. I swear to you, it will. Some people need a pill to sleep? Yeah, they do. And that's okay. If somebody's got congestive heart failure and a whole host and diabetes, we may have to give them a pill to help them sleep. That there's nothing wrong with that. Somebody could have paranoid schizophrenia and they need a pill to sleep. I'm okay with that, right? So there are very specific instances where medication makes a lot of sense. I just don't like medication forever, right? Like I don't like people on sleeping pills for 15 years type of thing. And I think that sleeping pills have honestly been overprescribed by many doctors. And I'll tell you the reason why. Most doctors aren't trained in insomnia in medical school. So here's what happens. I'm walking out the door. I put my hand on it's called the door handle diagnosis, by the way. The doctor puts his hand on the door, and as he's opening the door to leave with the patient says, "Oh, by the way, doc, I don't sleep so well." What does the doctor do? He reaches into his coat and he pulls out a prescription pad and he says, take, these 30 Ambien and let's see you in 30 days and see what happens. That's 99% of the time what happens when you're getting a pill to sleep, which is why I usually tell people it's so much better to work with a PhD sleep specialist because they've got every single option out there for you. And that way you can figure out what's going on. 99% of the accredited sleep centers out there have PhDs associated with them. So people can find these people or find them within the community. Just contact the local sleep center and they should be able to help you out.
Awesome. Okay. So we have another question here. Does sugar intake affect the effectiveness of taking the liquid drops melatonin? There was a time when I had, the question just jumped. There was a time when I had something sweet around 1 p.m. I can't fall asleep after taking some melatonin drops.
So that's interesting. So you may have had a reaction to sugar. Here's what I can tell you is I've seen melatonin chocolate before, and it seems to be very effective. So if you need melatonin. So to be honest with you, you may have some kind of a sugar thing that's going on with you. By the way, sugar suppresses melatonin, especially sugar eaten right before bed. But if you ate chocolate during the daytime and you took melatonin at night, I'm going to be honest with you, I don't see any way those two meet because it would clear out of your system in probably 30 minutes. And we're talking hours later. So I really feel like it was probably something that was more on the mental side than on the sugar side.
Okay, awesome. So we have another question here. I struggle trying to sleep when traveling on a plane. Any suggestions to help with this, especially on lengthy flights?
Yes, I have some very, very specific recommendations. So number one, there's a website called seatguru.com. It's amazing. If you go there and you type in your flight number, it will bring up a schematic of the fuselage and it tells you which seats are better for sleep. It's pretty awesome.
Wow.
So you got to check. It's like red light, yellow light, green light. So you got to check it out. It's super cool. That's one thing I tell people all the time. Number two, don't rely on the airline to bring a good sleep kit. Make your own. So what I tell people to do is get your own earplugs, get your own eye shades, have music that is relaxing for you. Bring extra socks. I always tell people also maybe bring a little thing of mouthwash because when you fall asleep, you get that terrible taste in your mouth. And when you wake up, it doesn't feel too good. Keeping all of those kind of things on you, on your kit, things that you know work for you are always going to be an advantage. Obviously, sleeping in first class is going to be a lot easier than sleeping in any of the other in coach. And then try to avoid the galley and the lavatory because that's where people have a tendency to congregate and that's where people tendency to have the greatest noise. When I'm looking at sleeping on an airplane, I like to get the seat next to the window so I can put my head against the side of the fuselage and with a pillow, and that seems to work out pretty well. That's another thing. Bring your own pillow. Most of the time, the airline pillows, if they even have them, are terrible unless you're in first class. Then they're actually pretty good. If you forget a pillow, what I do all the time is I always bring an extra sweater and jacket. I'll stuff my jacket into the arm of the jacket and it creates a long pillow that I can then wrap around my neck and push back. And I've got a built-in, a pillow there for myself. Meanwhile, I've still got on something, and you always want layers, by the way, because some planes are freezing and some planes are super hot. So that way you can kind of, adjust your temperature sort of as you need to. The biggest thing that I do though, if I'm traveling internationally, and I want everybody to take this down, is I download an app called Time Shifter, Timeshifter. We can put it into the chat for folks if they want to see it. This is a jet lag program app. So 2 days before you fly, you have light, caffeine, napping, and melatonin in very particular orders. So when you land on the time zone that you're in. So if you're going from, let's say, Los Angeles to Paris, you do this plan. When you arrive, you are on Paris time and ready to roll.
That's pretty cool. Not
It's
gonna
awesome.
lie. What was it called again? Time Shifter?
Time Shifter. It's actually now being used also for shift work.
Okay, awesome.
Yeah.
Okay, so next question. You say chronotypes are very much genetic. I can confirm that I'm a dolphin, but my children are definitely bears. We all did the quiz. What
Perfect.
can I do to keep from converting them from bear to dolphin?
So good question. So number one, everybody goes through all of the chronotypes except for dolphin. Okay. So think about it, when your kids were babies, they were lions. They went to bed really early. They woke up really early. They had their energy when they had their energy. Then they became toddlers. They became bears in that kind of age range from probably 3 all the way on up till about 10. Then they become wolves. If you've ever had a teenager, you know what I'm talking about. They like to stay up late and they like to sleep late. So they become wolves during that period of time. When you hit about 18, 19, 20 years old, that's when your chronotype seems to set for about 30 years, 35 years. Then your melatonin production starts to go backwards again, kind of like why grandma and grandpa eat dinner at 5:30. So then you might change your chronotype again. So we do see this thing that I call chronolongevity, where you will move through the different types as you age. Your kids won't set up a chronotype until they're probably about 18, but knowing that they're bears, keeping them on that bear schedule is going to be awesome for them in the long run for sure.
Perfect. Okay. So next question. Someone asked, I've started to incorporate a sleep schedule, but I'm still waking up feeling tired. How long after incorporating such a schedule will you start to feel more refreshed/more rested, assuming your sleep quality is good?
Yeah, usually it takes about 21 days or so is what I've found. And it's all about how strict you are with your schedule and how close you are to your chronotype. So if you figured out what your chronotype is and you know what your schedule is, if you can lock and load that for about 3 weeks, usually you start to really feel a difference then. But again, consistency is the key. And the wake up time, that's where I want you.
Perfect. So the next question. This person's asked, I'm not overweight, but my husband says I snore lightly often. I don't feel that lack of oxygen feeling that wakes you up. I do wake up with a very dry mouth though. Can light snoring be a sign of apnea? So
unfortunately, yes, it can. Also, you telling me that you have a dry mouth, it indicates something else to me as well. So what's probably happening is you're probably getting some level of nasal congestion, which is causing inflammation, which then forces your mouth to drop open because you're not being able to breathe through your nose. And now you become a mouth breather. We know that mouth breathing is kind of like the first sign on the way to getting sleep apnea. So what I tell people all the time is if you've got light snoring, you wake up with a dry mouth, it's probably not the worst idea to either do an overnight oximetry test or a home sleep test. This way you may not have to go all the way into the lab, but we could do a simple screen, really be able to figure that out and be able to make sure that you're safe and moving in the right direction.
Perfect. So another question here. I have tried taking melatonin gummies once, and my husband noticed that I snored so loud that night, and he had a hard time waking me up. Yep. I'm normally a light sleeper, and he recorded my snoring. It was so loud that I actually got scared, and I didn't take the gummies again.
Good. I'm thrilled. You probably didn't need the gummies, number one. My guess is the gummies were at 3, 5, or 10 milligrams, so you were probably overdosing, which is probably what put you into such a deep, deep sleep. The question then becomes is if you don't snore without melatonin, good news, stop taking melatonin. You probably don't need it anyway. And that's a good sign that you're not snoring during that period of time. What I would do, however, is keep an eye on, like ask your bed partner to keep an eye on you, because if you snore at other times, or that is something that happens over time, that's something that we may want to take a look at.
Awesome. Okay, so I've got another question. And it's, I sometimes use marijuana to help me fall asleep. How does that affect my sleep?
So it's a great question. So if you go to my website, thesleepdoctor.com, and you click on the blogs and you type in cannabis, I've written probably 9 different blogs. I mean, probably 16,000 words on cannabis and sleep. So let me give you the kind of quick breakdown. So far, we have not seen any CBD only products as particularly helpful for sleep. Lots of marketing out there says it is. I'm here to tell you, I have not seen the data. The only data I have seen for CBD in particular was one study where you needed 120 milligrams of CBD to have any type of somnolent or sleepiness effect. However, if you have THC in there, I do believe that it lowers your anxiety and can help with sleep. However, THC lowers REM and increases heart rate, which isn't good for sleep as well. So if you're looking for a cannabis solution for sleep, you want low THC. So you don't want to have something that's a high potency. You want to have CBD, but there's something else that you want to look for, and it's called CBN as in Nancy. This is actually oxidized THC, and there is data to show that this can be helpful for helping people fall asleep. Once again, be careful. This is not the situation where you're trying to get stoned. You're trying to go to sleep. So you don't want to get that psychedelic, groovy feeling, if you will. What you want to do is have something that helps give you a level of relaxation, and then you can move forward with your nighttime routine and fall asleep. I don't have a problem with cannabis use, generally speaking. I live in California, where it's both medically and recreationally legal. So many of my clients utilize cannabis to sleep. It is a natural substance and it can be very helpful, but you have to be careful with it, because if you're using it for sleep and then you're also using it for recreation, and then that turns into an issue, then you can have a problem on your hands. So be smart, be careful, read the blogs. I think you'll be able to figure out what you need.
Perfect. Okay, so we have one last question.
Great.
And then we'll start to wrap it up. So the question is, my husband snores constantly at night. It sometimes prevents me from sleeping as well. Is there something that we can do to help him stop?
Yes, there is. So number one, he probably needs a sleep study. Even if it's a home sleep study, we got to make sure that he doesn't have sleep apnea, because quite frankly, that's kind of a death sentence. Like if you have undiagnosed sleep apnea for a long enough period of time, you end up with cardiac issues, then you end up with stroke, then you end up with a whole host of issues that quite frankly, you don't want. Trust me on this one. I've seen it. It's not pretty. So I would get him tested. If he refuses to get tested, do the home test. If he refuses to do that, then you may have a problem on your hands, especially if it's like heroic snoring. Interestingly, there's data to suggest that if you sleep next to a snoring bed partner, you lose approximately 1 hour of sleep a night. So this is a critical moment for you, your sleep, and probably for your bed partner's sleep to try to get them in. Let's say that they're absolutely positively not willing to come in. They're not willing to do anything. Weight loss can definitely be helpful. Would be a good place to start. There are also internal nasal dilators. So if your bed partner has a significant amount of congestion, that can be helpful as well. I'm not talking about breathe right strips that go on the outside of the nose. I'm talking about something that's actually internal to the nostril that helps keep it open. That can be helpful as well. Personally, I use a product called Mute, M-U-T-E. It's $14. It is not a replacement for CPAP or a treatment for sleep apnea. I want to be hyper clear about that. If you only snore, that could be something that could be helpful as well.
Perfect. Okay, so sorry, we have one last question from the Q&A.
You keep saying that. I don't know if I should believe you anymore, bro.
I know. So it is, I always seem to toss and turn in my last half/third of sleep.
Yeah.
I use blackout blinds, sleep in a cool room, and have a consistent sleep schedule. Could there be an underlying issue, or could this be as simple as not having the right mattress?
It could be either or. So, when you see that level of restlessness and you've got all those other things that are kind of doing well, it might be time for a new bed. I tell people all the time, if you wake up more than 2 times a week with your back hurting or stiff or sore, it's your body is telling you it's time for a new bed. People are always like, when should I buy a new mattress, Dr. Breus? I wish there was like a turkey timer that you could put on the side. You know how like for Thanksgiving, you stick that thing in and when it pops, your bird is done. I wish we could do that with mattresses. Unfortunately, that's not the case. Our bodies will tell us what's going on. So if you're restless, it does mean that you're having difficulty getting comfortable. You may want to consider a new mattress. If that turns out to be a big spend for you and you're not up for that right now, try a topper. There are mattress toppers out there that are pieces of foam or latex that are maybe 2 or 3 inches that you can lay on top of your bed that can maybe make your bed a bit more comfortable. If you buy, let's say you buy an inexpensive topper and you put it on your bed and that helps you sleep better. Now you know you probably need a new mattress.
Great advice. Okay, so I think that is it. We'll wrap it up there. I just want to quickly plug Remologie. So Remologie is our website. We have an extensive blog with all sorts of content that we've written, including from Dr. Breus, who's written many articles for us, which are extremely good, and I would highly recommend reading them. But we have content from other writers as well. We also have our e-commerce store that I previously mentioned, and we offer home sleep testing, primarily in the province of Manitoba and Saskatchewan. So if you're outside of those provinces, it's a little bit difficult to get a sleep test to you. And the provinces are a little stringent on that kind of thing. So we really only offer them in Manitoba and Saskatchewan. But if you are in those 2 provinces, we can definitely help you out. So yeah, that's pretty much it. I just really like to thank Dr. Breus, of course, for coming.
Absolutely. Well, thanks for having me. Thanks for having me, Owen. I certainly appreciate it. And I did want to remind people that we do have some really good articles over at Remologie. There's one that talks about cannabis and sleep apnea. There's one that talks about, I think, alcohol and sleep apnea. So the common questions are ones that we've put something there. So please do go check out Remologie. We've spent a good bit of time developing the content there. I think you'll find it quite informative and extremely helpful. Also, there's all kinds of cool stuff on there as well.
Tons of stuff. And sorry, I have to correct myself. It's just Manitoba. It's not Manitoba and Saskatchewan for sleep testing. I apologize for that. Just Manitoba. So without further ado, I'd also like to thank Gloria, Shannon, Amy, and the rest of our wellness team here at the Innovair Group for helping to arrange this wonderful event. And yeah, that's pretty much it. I'd like to thank all of you for attending and providing excellent questions. And again, Dr. Breus, love to have you, and it's always nice to talk to you.
Well, I appreciate it, Owen. And I want to remind everybody out there that Remologie is doing it the right way. I've seen literally hundreds of sleep labs over my career, and Owen has really got a system that works well, that's easy to use, and that really makes people better. So I want you to go check it out. I personally have contributed articles to Remologie. I'd love for you to go over and see them there as well. Dr. Michael Breus here, wishing everybody sweet dreams, and get that sleep apnea checked if you got it.
Thank you very much. Don't forget to check out our subscription. We do ship CPAP equipment and supplies across Canada. So we'd like to see you there. Okay. Thanks, everybody. Have a great rest of your afternoon.